Hello, my name is KColwell, and I'm a senior athletic training student at Florida Gulf Coast University. Today we'll be demonstrating how to conduct a cranial nerve assessment. So there are 12 cranial nerves, and all of them are assessed during concussion testing to determine if any particular cranial nerve is damaged. I will go through all of the cranial nerves one by one, but if the athlete or patient is unable to perform the respective test for the cranial nerve, then that would indicate damage of the cranial nerve. So the first cranial nerve is olfactory, which is for smell. So I will have you smell this gum. What does it smell like?
Mint.
Mint, good. So cranial nerve number one is good for her. Cranial nerve number 2 is the optic nerve, which is vision. So this can be assessed through an eye chart or a Snellen chart and peripheral vision. So I will have you read this box over here. Can you tell me what it says?
Merry Christmas.
Good, so hers is good. The third cranial nerve is ocular motor, which assesses eye movement and papillary reaction. So I have this pen light here. If you look at me, all right, so her pupils reacted to the light, so her ocular motor cranial nerve is all intact. Trochlear is another eye movement cranial nerve. That's cranial nerve number 4, and that can be assessed by rolling your eyes up. And I'll just have you follow my finger with your eyes without moving your head. Up, down, side to side, diagonal. Good. She was able to do that very well. Cranial nerve number 5 is trigeminal, which assesses face sensation. So this can be assessed by having the athlete, can you finish your jaw for me? Perfect. And face sensation. So I'm going to put this on your face and let me know if you can feel it. Yes, and then on the other side. So she can feel all of those. Cranial nerve number 5 is good. Cranial nerve number 6 is abducens, which is eye movement as well, looking side to side, so lateral eye movement. So I'll have you, without moving your head, look as far to the left and as far to the right as you can. Good. So she's good with that one. Cranial nerve number 7 is facial, and that assesses taste and the face muscles. So we have some grapes here. I'll find one that's not completely gross. I'll have you eat that. Taste it. You can taste it. Is it sour or sweet?
Tastes like a grape.
Like a grape. And then I'll have you close your eyes. Smile. Good. So that actually got a little bit of cranial nerves 9 and 10 in there as well. Those are glossopharyngeal, which is cranial nerve number 9, and then vagus is cranial nerve number 10. Both of those test swallowing, voice, and gag reflex. She's able to swallow. I could test her gag reflex using a tongue depressor, putting it in her mouth and having her gag essentially. I will not be doing that, but that is how that can be assessed. Backtracking, cranial nerve number 8 is vestibular cochlear, which assesses hearing and balance. So I can assess that. I'll have you face the wall this way. I'll assess hearing first, so I'm going to snap in your ears, and I'm going to have you tell me which ear I'm snapping into, okay?
Right. Left. Right. Right. Left.
Okay, So she is good with that. Balance, I will not have her do because you won't be able to see it very well in this video, but to assess balance, you can have the athlete or patient stand on one leg for about 5 seconds, and if they're able to do that, then they should be set. If they are faulty and cannot balance for 5 seconds, then that will indicate some trauma to that cranial nerve. Already went over 9 and 10. For both of those, to assess voice, you can just have the athlete say ah. So say ah. We already checked that earlier anyway, so she's very well with those. Cranial nerve 11 is the accessory nerve. So that will assess the sternocleidomastoid and the trap muscles. So that can be assessed through a shoulder shrug. I'll have you face the wall again. I'll have you resist the shoulder shrug, so shrug up. Perfect. She is intact, so she's very good. And then cranial nerve number 12 is hypoglossal, which assesses tongue movement, so I'll have you stick your tongue out. Good, so she is good, and that is how you assess all of the cranial nerves.